I'm Sabiha Essack, South African National Research Chair in Antibiotic Resistance and One Health, a pharmacist by profession and professor in pharmaceutical sciences at the University of KwaZulu-Natal in Durban, South Africa. I am an expert consultant on antimicrobial resistance to the World Health Organization Africa Regional Office, the founder and co-chair of the South African chapter of the Alliance for the Prudent Use of Antibiotics, as well as a member of the South African chapter of the Global Antibiotic Resistance Partnership. The Global Respiratory Infection Partnership is a group of global, multidisciplinary healthcare professionals who are committed to mobilizing prescribers, pharmacists, patients, and the public in antibiotic stewardship for upper respiratory tract infections. GRIP aims to decrease inappropriate antibiotic use by developing a consistent global approach for behavioral change and encouraging symptomatic relief for upper respiratory tract infections. This will reduce antibiotic resistance to maintain and sustain antibiotic effectiveness and ensure the public's health for the future. As a pharmacist immersed in biomedical, clinical, socio-behavioral, and policy-related research in antibiotic resistance, I bring an evidence-based, multifaceted perspective from a developing country perspective, specifically Africa. I was the lead in developing GRIP's 5P pentagonal framework, as well as GRIP's input into the World Health Organization's consultation on its global action plan. And I keep GRIP abreast of global, regional, and national antibiotic stewardship programs. The most conspicuous gap in the action plan is the social behavioral factors that affect antibiotic prescription and use by prescribers and patients. The social behavioral aspect is a challenge that is faced by all governments and all stakeholders trying to address antimicrobial resistance. The Global Respiratory Infection Partnership has developed an innovative 5P pentagonal framework. This framework consists of policy, prevention, prescriber, pharmacist, and patient. The policy aspect relates to treatment guidelines or policies or algorithms that promotes prudent use of antibiotics and encourages symptomatic relief of respiratory tract infections in the first instance. It also speaks to the prevention of resistance by antibiotic stewardship to prevent antibiotic misuse and overuse. It focuses on the prescriber and provides guidance on antibiotic stewardship and effective communication with patients. It focuses further on the pharmacist, who has a role in educating patients on symptomatic relief and when to refer to a doctor. And then it finally focuses on the patient and encourages the participation and empowerment of patients on self-management and appropriate symptomatic relief.